Perfect. Welcome this morning. It is the first in our series of 4 webinars for in treatment, for parents in treatment. And today it is around looking after the patient. And welcome, Debbie. I'm Cullinane. I am Ray Brennan, and I'm the Director of the Psychosocial Services here in Childhood Cancer Ireland. And so, Debbie, I'm going to let it over to you to maybe talk a little bit about yourself.
Perfect. Thank you so much. And thanks for having me. Yes, my name is Debbie Cullinane and I am from Mayo, and I've been working with Childhood Cancer Ireland now for a number of years with their parent support workshops, their parent workshops that we've been doing around the country. And I do a lot of parent support online as well for any struggles that you might be having with something that's going on with your child as a result of the diagnosis or with the siblings or whatever the presenting issues are. So I'm a psychotherapist and a play therapist. I'm a parent of 2, and I have a lot of experience working with families who have been affected by cancer diagnosis. And I did work with a little boy who had ALL for a few years while he went through his treatment. So I did get a lot of insights into all of the procedural distress and the maintenance and the steroid weeks and what they can do to the mood and how it can be so difficult as a parent to try and navigate that. So hopefully today you will come away with a few different insights, strategies, things that you think might help you moving forward. And I know as you're watching this now, everybody might be at a different stage after diagnosis. So we'll kind of start at the start, and then we'll give you lots of different strategies to manage when you're in the hospital or when you're outside of the hospital, trying to get support when you can, and just trying to mind yourself in this whole thing as well, because it is obviously so difficult when you do hear those words. And we know that, and we just want you to know that we are here to support you as well. And Childhood Cancer Ireland have so many different things that you can utilize, from peer support to parent support to play therapy, coffee mornings, so that you can feel seen and feel heard and feel supported and feel that you're not alone. So you can check out all of those online, and Mairead might even say a bit about them towards the end as well. And in this webinar, we just want to try and to provide some support and practical tools for you to navigate this difficult journey. I do want to start off, like I do with a lot of my parent workshops, with this 3rd rule of secure attachment that dates back to the 70s now at this point. And this just tells us that in general parenting, which is a challenge anyway to us all, and then you're met with this bigger challenge of trying to take care of the patient and the siblings and everything else that's going on when you do get a childhood cancer diagnosis. But it's good to keep this in mind all the time. So we only need to get it right about 30% of the time as a parent. And that's good enough. That's all we need to do. 30% of the time we rupture, we get it wrong. Like, we might get annoyed with them, frustrated, and these feelings might come up for you as well. Is they might be behaving in different ways in the hospital when they don't like certain procedures, when they don't like certain medicines, when they don't like certain nurses or doctors coming near them. And we're like, come on now, you need to be able to do this, or you might be getting frustrated with any of the behaviors that is happening. And that's okay, because we get it wrong at least a third of the time, and that's all right. We rupture. But the important part is that we come back and we can repair that third. We repair, we come back, we let them know that they're safe and they're seen and they're soothed, and that we are back as their safe person again. So don't be beating yourself up at all if you're feeling like you're overwhelmed yourself and you might be getting a bit frustrated with different behaviors from your younger child or your teenager who might be experiencing this. They're all valid. They can be difficult, but that's okay. So just remember, only 30% of the time we need to get it right in general. I just want to start here. I'm not going to dwell long on this because I know it'll be dependent on what everyone's stage is at. But when we're talking to the child or the adolescents about their diagnosis, it is really important, we know, and they'll tell you this in the hospital as well, to be as honest as possible, have age appropriate conversations. That's really key. And we don't want to, as insofar as possible, be hiding information from them, because they're so clever and they're so attuned to our how we are, and they sense that something is off if we're not telling them, and that can heighten anxiety, and it can heighten mistrust, and it can actually heighten the fear when we try to keep things from them. So try to be as honest as possible. And for younger little ones, or even I think for everyone, it's a really good way to say it is that like your body is sick, your whatever part of them that is sick, and the doctors are going to give you the special medicine to try and help to make you better. And that's a lovely way to put it, because it's like this is happening to your body, and we're going to do the doctors will do everything they can and give you all the medicine, even though it might be so hard, to help to make you better. And if you've got older children, obviously they might want more details, and just be open to the questions, try to answer truthfully while balancing the hope element as well. And don't be afraid to just say, I don't know. Because we often need to say that as parents. They ask us these really tricky questions like, why me? Why is this happening? What's going on? And it's okay to say, I don't know. And I'll try and help you to find out, or I'll ask the question for you, or I don't know. And this sometimes is just what happened. Like sometimes we don't know. We don't have all the answers. It's like when they ask you any tricky question, I know lots of the little children can ask, what happens when you die, and all of these types of things. And that's really tricky. And like, we don't know. And it's okay to say that as well, because they're not going to know either. So reassure them that you're there and you're in this together. And remember that the experience of this trauma that you're going through will be different for everyone. So you will look at it through one lens. It'll happen for your child through another. If you have a partner or a support person there, it'll happen for them in another way. And that's okay. Just try to process it from your own perspective. And remember that your perspective isn't your child's. So they will be looking to you to try and seek that safety and connection from you, even throughout the process of the treatment. And that's why we'll talk about how minding ourselves is super important, even though I know that it's difficult and you're like, it's the last thing that you want to be thinking about or doing. So the diagnosis has a huge impact emotionally on the patient themselves, and they will all process it again in a different way based on their developmental stage. The little ones mightn't fully understand what's going on, but they will sense the anxiety and the stress, and they might then express that through behavior, because that's the only way that they communicate to us, really, through their behavior. So every behavior is a communication, and the little ones won't have the language to put on how they're feeling. So you'll often see it coming up in the tantrums and the not nice words to the nurses and all of these things that might be going on. And this is really hard for them. And the nurses and the doctors have seen it all before. So don't be like, oh, what are they doing? They shouldn't be doing that. We should be able to get whatever procedure is that they don't like done quicker. It's really hard for them. And that's okay. And we just need to try and help and support them through it, and let the nurses and doctors try to get around the child. And they will eventually, once they build relationship with them as well. You find they can be very fearful initially, and then they start to build safer relationships with the nurses and the doctors that come in and out to them throughout their stay in the hospital. School age children then might worry about missing school and missing friendships, and that can be hard. And sometimes adolescents struggle with the body image, their feelings of independence, and their feelings of being different to their peers, and it can feel like a deep sense of unfairness as well, like, why did this happen to me? And all of these feelings of fear and anger and loss of control and sadness and loneliness and withdrawal are so common. So we need to try and look at how we can support their needs as parents. So the first thing really to do, and I do this all the time with children, adolescents, and people in general, is just validating all the time. I get it. This is so hard for you, and you hate this. You wish that this wasn't happening to you. I totally understand. So we don't come in with that, but it has to be done. And we have to do these things. And in this amount of time, it'll be. So we let go of the fixing and just sit in the moments of the validation of, I know, I understand that you hate this. I get it. It feels really hard. It feels really sad. It feels really annoying. You don't want to do it. You don't like that nurse. You don't like that person. Validate all the time for them. I get it. I'm with you in it. There's a lovely piece of research by Mona Delahook that tells us that when we experience trauma And the impact it has on us isn't actually the trauma itself, it's the aloneness that we feel in it. So we want them to feel that they're not alone in this, that we are there and we understand that this is so hard. Try to also encourage open communication. So we've got age appropriate conversations, let them ask questions, provide a sense of control when you can. Let them make choices where possible. That'll be different for the teens and different for the younger ones. You know, what teddy to bring, what book to bring, which game to play. Try and give some options for control. And even in relation to their experience of what's happening to them for the teenagers, we can try and ask them about what they would like to do also. Offer coping strategies is always good. Distraction is always great. We all need to be distracted. We cannot sit in this full time, because that's way too hard and we will experience burnout and our brains will get overloaded and our bodies will get overloaded. And it's the same for the children and adolescents. So anything that is distracting for them, drawing, coloring, relaxation techniques. And I have deliberately put this in here because it comes up a lot. Do not be afraid of screen overuse at this time when you're in the hospital or when you're out of the hospital. We are surviving, we are not thriving. So anything goes to help with the regulation. It's okay. It's absolutely okay. It's not going to have a huge effect on them because they're sitting on the screen all the time. If they are regulated and it's taken their mind off what is going on, then it's absolutely fine that they're sitting there doing it or they're listening to their music. We try and just get through this period in the best way we can. We do it good enough so that we can get through. If they are able, depending on what stage they're at, in or out of the hospital, try to connect them in with peers. Phones for the older children or online games. There can be emails, letters from the school. You can do video calls. When the patient is able, this is lovely to keep them connected with the schools. And so obviously if some of them during maintenance will go back into school and some of them won't be able, it depends on what's going on, but it's lovely to keep that connection. And schools are great to come on board to try and make sure that there is definite connection and communication happening between the patient and the friends still at school. And when you're in the hospital as well, definitely utilize the play specialist and the psychology where it's available if you feel that you need the extra supports, because they're fantastic up there as well. This is just a small section on if you're having trouble with the communication around with your healthcare providers and the doctors and the nurses. And this comes up a bit as well. When your child does get diagnosed with childhood cancer, it's like you learn a new language. And you're like, all of these terms that I never knew before. And this has come up in parent workshops as well. It's like you become part of this club that has all these words that you never knew before, and it's not a club you want to be part of. And unfortunately, this is where we are at. But remember, you are your child's advocate, and it's okay to ask the questions and ask for information to be repeated if you don't understand, because we don't understand. You don't know until you know. Trust your gut as well. If something doesn't feel right, speak up. Try to have conversations, not confrontations where possible, and stay curious. So just wonder about things, ask for it to be explained again. It can be so confusing with all the medical terminology, and it's okay to feel overwhelmed and like you can't process all the information because there's so much to try and take in. And if you're finding it tricky, if you can have someone with you when you're speaking to the medical team or telling you what the next steps are or telling you what you need to be administering at home or in the hospital, it can be really hard because we're living in our stress response system. So we're already in our fight, our flight, our freeze response as a result of the diagnosis itself. So then trying to even take in and remember all of that information is so difficult. So definitely be writing things down, have someone with you, even if you can do some recording of voice notes for yourself so that you can remember straight away what came out, because our brains are all muddled. We're all over the place in general. And then trying to manage and navigate this on top of it can be so, so difficult. Caring for your child or adolescent with cancer is emotionally, physically, and mentally exhausting. Trying to manage that stress is so important for your well-being and for your child. And there are a few things that can help. And I don't want you at this point to be like, oh, don't even talk to me about trying to mind myself, because I can't. I get it. I do. I absolutely do. And this can just feel like, what are you talking about? As if I could have the time to even contemplate minding myself. And I'm not even going to say that other word that can sometimes feel like, don't even mention the SC word to me. No, 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 because that's not going to happen when I'm dealing with all of this. However, there are small little things that you can do. And like I said just a few minutes ago, when we can't live in this constant state all of the time, because often with diagnosis, initial diagnosis, particularly depending on what it is, you may be in hospital for a long time at that initial diagnosis stage. And that is really tricky and it's really hard. And you need to try and mind yourself in that once the initial shock has settled. And it can't be 24 hours a day that you are so heightened. So, doing things even for yourself that can help you are really important. Talking is a big one, and it's dependent for the person. So, acknowledging your own emotions and talking to people about it. It's okay not to be strong, and it's okay to let all the emotion out at times. And I often find when you let it out, you do feel a little bit better and you're able to go back in. Like, it can be quite cathartic. It can help you to just get it all out when you can. And I don't mean that every mother and father and carer try to be holding it together in front of the child. And I get that, because that's what we want to do. We want to try and be their safe person. But you will have time where you will be able to make those phone calls and talk to other people outside of the room where your child is, and just try to get it out and seek that support and that connection from friends. And I know that people find this hard because it can feel like nobody else gets it, like nobody else understands what we're going through in here. But I do think there's a real genuine want for other people to try to understand and to be there for you. Nobody's going to feel about the diagnosis in the exact same way as you, because it's so hard as a parent. If you do have a partner there with you or a support person, they can be in it with you, but just try to seek it out when you can. It's not that you'll be able to all the time, and sometimes you won't want that at all, and that's okay too. Your physical health is really important. But I know so many people that have gone through the John's ward or whatever hospital you're in are just like, it's so hard to even get nutrition. It's so hard to get some healthy food, and you're down at the vending machine and you're picking up a Mars bar when you can, and that's okay too. But even think about your hydration. We talk about this a lot at the parent workshops, Maria. Even if you can get the water in, that is actually really going to help you. And nutrition, what you can, when you can, and try to make the better choices when you can, or that someone might bring you in something. Sleep, I know that can be really, really difficult at this time as well, but where you can, try to get some sleep. And then movement, even when you're in the room with the child or the adolescent, there's a lot of time where you're waiting and you're in there around. So maybe rather than sitting, just get up, small movements, stretches up to the sky, down touching your toes. And like, this can be really helpful for some people. I know I've worked with a family before, and it really got the mother through that time in the hospital, because she just brought in her few things, her resistance bands, and she did, and she worked out in the room, because that's what was getting her stress levels down. I'm not saying it'll get yours down. You might have no interest in that, but if you can get small movements in, or like listen to a meditation on the phone, try and bring in small tiny moments of calm or joy where you can. Deep breathing, music, podcasts, journaling if you like it, watching a show when you can, because there is a lot of time where you will be waiting. And this might seem like one that you're like, oh, I couldn't, but allowing yourself to laugh where you can. And I know this is a really tricky situation. But I do think a lot of us, even as Irish people, are able to have a little laugh, find a bit of humor with your partner about something, or someone there, or your sister on the phone, because humor can be a really powerful stress reliever and it can really help us to get through. Um, that is when you are able. I'm not saying that you will be able to use humor all the time, but it's good to be able to laugh sometimes. Once the initial shock is over and you have um, your plan in front of you. Accept help is another big one. And this one can be so hard to food, childcare for siblings, household tasks. You don't have to do it all. This is the time, even if you never wanted anyone to help you before, ever, when your children were small or they were babies or anything like that, this is the time. Give yourself permission to say yes. Yes, I do want that help. Yes, please drop me over a curry. And if someone is maybe putting out a very broad, if you need anything, let me know. Great, yeah. Will you drop me over dinner on Tuesday? Or will you drop it over to my partner at home? Or could you pick up my child from this? Or, people actually do want to help, because people in your circle and your support circle outside of the hospital, if you are still in there, feel quite helpless and they're not sure what to do to help. And it's nearly great to be told exactly what you need them to do. So you're like, okay, on Tuesdays, I'm going to do the dinner. On Wednesdays, you'll collect her from this. And it's great. So please do give yourself permission to say yes to help. It's not the easiest thing to do for any of us, depending on the situation. And I've said already, let go of pressure to be strong all the time. You don't have to be strong all the time. This is really tough. And it's okay to feel all of the emotions. And this is a big one that comes up as well. And they will tell you this in the hospital, but try not to Google, and try to set limits, educate yourself, but try not to build that anxiety, and use trusted sources, ask the doctors. I know there are some groups for parents as well that can be really helpful, but when we're scrolling like that, we want to try and avoid worst case scenarios, because that is unhelpful to us and it's going to worry us further. Practicing self-compassion is really important too. You're doing your very best in a really difficult situation. Please be kind to yourself, because this is not easy. Focusing on one day at a time. I think this is a good one, just to try and bring us back into the present, because when we are anxious, we are living in the future. So we have all these anxious thoughts, and there are things that may or may not happen in the future, because none of us have any idea of what tomorrow will bring. So, and then if we're sad, we are living in the past, or we're going over things in our heads and we're ruminating. So if we can bring ourselves back to the present and focus not even on one day at a time, but like on getting through the morning, on then getting to lunch, on getting through the evening as best we can, and having as restful night as we can get. And whatever tomorrow is going to bring, we'll tackle it then. I always use it. That's future Debbie's problem. That's tomorrow Debbie's problem. Today, I'm going to try and just be present in this moment. And that can really help us to even stay in connection with ourselves and with our child or with our teenager. If you have your partner or support team, tag them in if you can, when you feel you can, and have open conversations about each other's strengths. This is such a difficult time, but it's great to acknowledge what your strengths are and what your limitations are and what your emotional bandwidth is. And you can do this. I know a lot of people text each other like, I'm really struggling. Can you come and get this? Can you come into me? Because you don't want to be talking in front of the child or the teenager. So it's great to message each other about these things. And yeah, just notice your own strengths. And it's hard because it's so different for everybody. So you might be a fighter and you might be really, really good at managing these difficult situations, and your partner or your support person might be a freezer. So they just mightn't be able to to take it all in, or they might be quiet and you're like, what is wrong with you? Or they mightn't be showing emotion and you're like, why aren't you showing emotion? But we have to recognize and respect different coping styles. Some of us need to talk, some of us need quiet. Try to give each other space to like grieve the life, because that can be, it's such a big shock, and life as you knew it is taken away for now. To vent, to take a break, because everyone of you involved in this, you're all carrying a really heavy load, and we all carry that load in different ways. And it's easy to get annoyed that someone's not responding or reacting in the same way as you are. But that's just, all of us have different ways to protect ourselves and to try and cope with the stresses that are thrown at us. Why is trying to mind yourself so important and essential? Well, we know why, but I just wanted to put in a few slides on this. And this is non-judgmental and with no pressure and going back to the 30% and all of that. But emotions are contagious between one person and another. And I'm really thinking about the patient here. So our nervous systems feed off each other. And when you can breathe and feed yourself well enough, move a little bit, name how you're feeling, you can be grounded with hope and confidence, and that contagious calm that can really be helpful for your child and adolescent, because you know we're the safest person in our child's world, and they look to us for that safety. Insofar as possible, we try and share that contagious calm with them and help them again to go back to the safety, to feel seen, to feel soothed, and to feel secure as much as possible in this really powerless place that you find yourself. And we really want to try to be their anchor as much as possible, to provide kind of a calm and a hopeful confidence when we can. And again, tagging in, and this doesn't have to be right all the time, just validating this is really big and really hard. And we know what we have to do now, and we're going to take the steps together. And when they sense that we are steady and we are grounded, just like an anchor in a storm, then they feel protected and their nervous system is supported. And they look to us for that. So just trying to do that as much as possible. And this is the key to this co-regulation piece that we hear everyone talking about all the time, this co-regulation. When their storm meets our calm, that's when co-regulation can occur. But it's only if we're able to try and mind ourselves and be as regulated as we can be, so that we have the opportunity to mind them as best we can. And this is a get through time. Getting through. That's what we're doing from initial diagnosis all the way when you are in the hospital or out of the hospital. And I've mentioned this already, but let go of the feelings of worry about screen time, about them getting presents and about them getting treats and about everyone spoiling them. This is a big thing that comes up a lot. All you're trying to do, and all others are trying to do, is make and help the patient to feel better, to feel special, to feel distracted, to feel safe. And for this time, that's absolutely okay. Don't be worrying about it. It's not the time for parenting strategies or parenting values. It can change for this time, especially that time of initial diagnosis and when you're in the hospital and during the treatment stage. And this can all be reestablished later. So it's not that all is lost and that this behavior has come up and now, oh, what are we going to do with it? It can all be reestablished at a later date. And this will be with baby steps too. And at that later date, we can also support you through that when you're trying to reincorporate your parenting strategies and your boundaries and all of those things. But this really is a get through time. And try not to stress again about your child if they're behaving badly as a result of procedural stress or anything like that, because this is all normal and they will all respond or react in such different ways, depending on the child and even their lived experience of the world and their age and their developmental stage and all of that. They will all react so differently. So don't think that they're doing anything wrong, because this can be so hard. And also, this time is really difficult for the siblings too. And that's why there is there is another webinar that you'll be able to watch after this one, that will be on soon, all around how we can help siblings to navigate this journey as well. So that will be available. So now just come along to question time. Maria, you probably have bits and pieces do you want to say or add in there?
Thank you, Debbie. That was brilliant. Yes, I just wanted to say that, first of all, there's lots of things that came to mind for me when you're saying that. I'm just thinking, I love the idea of being okay with their behavior. That nurses and doctors are so familiar with that and understand it. And, it is their way of getting some level of control or able to express how they're feeling at that time. So that's so important. And also the idea of the validating and not fixing, because that's, as parents, we can very much want to make sure that, the big feelings are not there. But it's a time to allow and validate them and support them in those big feelings. And the 30%, I always go back to the 30% myself of, being there 30% and being present 30% of the time is what we're striving for. And, you didn't use the SC word, but I'll use it, the self-care word. I try and apply the 30% to that too.
Yeah.
Because you mentioned about enough, and it's not about more things that you can, now I've got to self-care as well. So here's another thing I have to do on top of everything else, but that it is that you can lean towards it, and that small little self-care or looking after yourself moments is enough. So that it doesn't become something that you're beating yourself up about. It's about, can I keep it in mind? Can I take that stretch? Can I take that sip of water? And the most challenging part, as you said, is the looking for help or asking for help, because it can come with kind of sense of, I can do that. I'm giving away my independence. I'm, giving away a little bit of control. But and also I kind of almost sometimes have to be very specific about the care I need, which can be another step that I have to get through. But that it's something that you can take back those different tasks or different tasks or responsibilities with time, that at any time you can say, that was great, thank you.
Absolutely.
Now I'm able to take it back. So it's that control is always there in your court.
And I think it really gives people in your support network a sense of purpose too.
Yeah.
They do want to help. And there's very little you can do when, you're in the hospital and you're at home wondering, how can I make this 1% easier on them?
Absolutely. They're only too delighted to be told exactly what you need.
Yeah.
And it can be micro things, can't it? It can be tiny things. You'd hear from so many people saying, oh my Lord, my neighbor came and cut her grass and didn't even, just mention they were doing it casually. And, just all those little things that can help, that can be really, really helpful. Another thing I wanted to mention was around when you're talking about the emotional responses of children and adolescents and young adults, that sometimes I hear from families, and you do too, around, they coped really well. I can understand maybe some of the procedural distresses, but they were absolutely troopers. And I feel that emotionally I'm struggling a little bit more than they have been. But now that they manage things so well, I'm wondering when they're going to hit the wall, a wall where, it all hits them. They may never, they may be using their strategies. They may be, so supported by you that they, that doesn't occur. So it's not to have reassurance around that. And it is, as you say, anyway, that, we mind today. If they're struggling later on down the line, we have a full range of supports that can support you and them.
Yeah, and that's a really good point, because I do think that comes up a lot. What's it going to be like now? Oh God, it's definitely going to hit them at some point. When is it going to happen? Yeah, that's a really good point, because and like you say, it may never.
Yeah, absolutely. Yeah. And there was something else I was going to say, but now it has slipped my mind, and I'm not going to take up any more time. But what I'm going to say is thank you, Debbie. And There will be time for questions and answers once we stop the recording, and we will share this with everyone, be on our website as well. But I suppose this is just one of the supports we have, is that psychoeducation with our webinars, but that there's, as Debbie mentioned already, a whole range of supports for you and for your children, both the patient and the sibling, both now and at different stages, whether it's during treatment or post-treatment. So it's just to keep an eye on our social media, to link in at any time with myself or any other team, and we can, connect and give you a whole range of, let you know the whole range of supports that might be appropriate to you or your family at that time. Okay, thanks, Debbie.
Thank you so much.